Management Services in Columbus, Georgia. You know, we spoke recently about how important it is for your anesthesia coders, billers, and providers to all be familiar with Medicare LCAs, LCDs, and also anesthesia medical policy that is published by other payers such as Aetna, UHC, Cigna, Humana, etc. So today we're going to try to get a little more specific just for a couple of minutes. I've got the Cigna medical coverage policy in front of me for anesthesia services for interventional pain management procedures in an adult. Now, as I mentioned before, providing anesthesia for interventional pain management procedures, it can be lucrative and profitable for anesthesia groups, especially in an ASC setting that's owned by the surgeons. But you have to know exactly how to play the rules to get these paid. For example, with the Cigna policy, let's get specific on it. This applies to both Cigna commercial products and also the Cigna Medicare Advantage products and plans. If you look at their medical policy coverage for anesthesia for interventional pain management procedures, they do list specifically the CPT codes that would be billed by the surgeons. And then they do list specifically some of the anesthesia circumstances that you would expect to see to qualify for reimbursement. Just as a few examples, the presence of any of these in a patient, it'd be expected to see increased risk for complications due to ASA physical status 3 or above. Normally in an ASC, you know, you're going to see physical status 1, 2, and 3 patients, maybe now and then a 4. A 4 would normally be done at an outpatient hospital setting, not an ASC, or not a surgeon's surgical suite. Some of these core comorbidities would be expected to see for anesthesia provided for interventional pain procedures, such as severe cardiac disease or pulmonary disease, documented sleep apnea, morbid obesity where their BMI is greater or equal to 40 kgs, chronic renal failure would be expected as a diagnosis, end-stage renal disease, chronic liver disease, end-stage liver disease, age over 70. We see this a lot. Severe anxiety or other psychiatric conditions and cognitive impairments which would lead to someone being medically necessary for anesthesia for pain management procedures. Spasticity or movement disorders such as cerebral palsy, dystonia, brain injury, stroke patients, individuals that are at risk of airway obstruction, history or anticipated intolerance to monitored sedation, such as chronic opioid use, history of drug or alcohol abuse. If you actually drill down into the medical policy itself here with Cigna, those are a few things that are listed, but there's actually over 500 ICD-10 diagnosis codes that would be acceptable for monitored anesthesia care or anesthesia care of some sort, such as the use of propofol for a separate anesthesia provider to be rendering these services for a surgeon's service here. So again, we encourage you to be familiar with your specific payers' medical policies. You've got to know how to code. Make sure your coders know, your providers know, and your billing specialists, your data entry people, your follow-up AR people, make sure they're all on the same page with these medical policies. But again, as I said before, you can't just code it to get it paid. It's got to be documented in your anesthesia record. Typically, this is done in the pre-anesthesia evaluation assessment by the anesthesia provider, and so that's part of your anesthesia record that you own. So we encourage you to be familiar with these. And by all means, if there's anything we can do to help you, look at your revenue enhancement opportunities, then give us a call. That's Mark Banning with Medical Management Services here in Columbus, Georgia. I can be reached at 706-315-4660. Thanks and have a great day.